If I could have, I would have started sooner. This is what it's supposed to have been all along. And so I decided to just start the process. You have to thrive in environments that are harsh, and you have to do your job and show up for patients regardless of where you're at and what's going on. And so I'm here and I'm open and willing to see people every day, same day, next day. And so I just say, just go for it.
I'm Dr. Ann Gonzalez. A lot of women are opening direct primary care practices right now, and from the outside, it looks independent and flexible. But what I keep hearing privately is how much of it they're carrying alone. Every decision, every system, every patient situation. There isn't really a colleague down the hall anymore. So we're doing something a little different. We're hosting a small in-person gathering for women in DPC. It's not lectures or a conference, just conversations about how practices actually run, what's harder than expected, and what we have experienced. And honestly, that's also why I built the systems I use now.
Welcome to DPC Life, the podcast where independent doctors share real stories, bold ideas, and the freedom of doing medicine on your own terms. I'm your host, Dr. Ann Gonzalez, and together we'll explore the wins, the struggles, and everything in between. Let's dive in. Today, my guest is Dr. Lyndsi Cress. She is a family medicine physician, West Virginian turned South Carolinian now in North Myrtle. What is it? Little River, right? Technically.
Little River, that's right.
Okay. Yes, and we met a couple years ago. It was almost 2 years ago now, I think.
Yeah, it
Yeah,
was September
it
2 years ago.
was. And we met at the Mastermind in Greenville. And I don't know, let me see. I was trying to show, I have a picture from the Mastermind. And I was
Okay.
cleaning out pictures off my phone because my phone is completely full and I can't do anything. 'Cause
Right.
and I'm just like going back and looking and erasing. And I was like, oh, look, there's the Mastermind. And I was looking closer and I thought, oh, look, there's
Is it the
Dr.
one of all of us, the
Lyndsi.
big group?
Yes.
Yeah, that was such a good picture.
That was great. And I was like, oh,
Yeah.
there's Lyndsi and Angela. So there are a bunch of people that,
Yeah.
yeah, are now in practice. So, well, you opened in March, correct?
I did.
Yeah.
Yeah.
All right. Well, tell us a little bit about the backstory, how you got into DPC and, how it's going.
Yeah. So it was a long journey. When I entered medicine in, well, what I don't want to say, but a while ago, um, I was always in these employed hospital systems, right? So I was an employed physician since day one, since right into residency. So it was constantly go see more patients every 15 minutes. And when I first got into residency, I was like, I didn't think this is what it's supposed to be like, but okay, I guess it's just being a resident. You just truck along and get it done. So I was like, oh, it'll probably be better once I'm an attending and an employed physician and out of residency. So left residency, went into my first job, and I worked for an FQHC, and it was okay. But it was more of the same. See more patients, meet your quality measures, click those boxes. And so I was like, well, okay, maybe it's just this job. Maybe it's not right for me. And so I was still living in West Virginia at the time. And so we weren't really happy with our location. So we decided to pick up and move to the beach we ended up in North Myrtle Beach, and I worked for a large healthcare system in this area. And it was good. They were very good to me as far as taking care of their physicians. It was a good company to work for. But again, it was more. See, every 15 minutes, I was up to 20 to 25 people a day. And I did that for the last 5 years. And it was just over time, I was just getting more and more burnt out, which I thought I kind of struggled with that from the beginning because I just didn't realize that's what medicine was supposed to be like or was like whenever I entered medical school. My thought was that I would get to spend more time with patients, get that relationship built up, and it just wasn't like that. So I decided that Whenever I went home every night and I was exhausted at 6 o'clock in the evening and I
Mm-hmm.
had 2 hours left with my kids, and in those 2 hours, I was not my best self
Mm-hmm.
because I was so emotionally and mentally drained.
Right.
I decided that I had to do something. And so I was at the point 2 years ago when I met you. I was just looking for something, anything that I didn't have to do that, to be in patient care even. I was looking at insurance company jobs, like working for the enemy. I know.
That bad.
But just anything to get out of that scene because I was just so burnt out and exhausted. Um, but I still wanted to use my medical degree, obviously. And so I deep dived into the internet and stumbled upon I think it was a podcast actually, of a DPC doc and talking about how it changed his life and how he was able to see patients and still have time for his family. And I said, this cannot be real. There's no way this is real.
Yeah. Yeah.
So again, did another deep dive into the abyss of the internet, and yeah, lo and behold, I said, this is it. This is what I've been looking for since I was a resident.
Mm-hmm.
This is what it's supposed to have been all along. And so I decided to just start the process. And I did a few conferences, the DPC Summit, I did the Masterminds group. And after that, I drank the Kool-Aid. It was like, all right, ready to go.
No
Let's do
going back.
it.
No going back. Yes.
Yeah.
Okay. And so you went to the mastermind with your husband, who
Yeah.
he's a stay-at-home dad, correct?
He is. However, he just got a job and so actually starts Monday
Oh,
at his
okay.
new position. He's going to be the director of operations at our local fitness center.
Oh,
And
great.
so yeah, his
Yeah.
background's in
I
fitness. So
remember. Yeah.
yay.
Yes. Well, you're
Takes a little pressure off of me, but
that's
yeah. So,
true.
but
You're
he's been super supportive since
mhm.
day one.
Mhm. And your
Hmm.
kids are now in school or
So I have an 8-year-old and a 4-year-old. So
okay.
yes, my 8-year-old's in third grade,
Mhm.
and the 4-year-old's still in preschool.
Mhm.
So
Mhm.
yeah,
Yep. So with him being at home, at least when you started, I'm sure that was nice not to have to worry about the kids and having to go pick them up or
yes, absolutely. That was all him. Bless his heart. He
mhm. Mhm.
he did the laundry. He cooks dinner every night. Picks the kids up from school. So as an employed physician, I got home and everything was already done. It was
Mhm.
so
That
nice.
is nice. That is really nice.
But yeah, but now since I've had more time, I've been able to pick the kids up,
Mhm.
and I even started cooking a little bit when he needs me to.
Oh,
So
wow. Look at
yeah,
that.
I know. It's not like I didn't know how. I
Yeah.
just don't
Didn't have
like it.
I'm with you. I'm with you. Yeah. That's awesome. So he also was on board like from the very beginning, or did you have to convince him?
There was very little convincing. His background, he owned his own fitness centers and gyms. So he's always been a business owner.
Mm-hmm.
And so he saw the potential. When he learned about DPC2, he said, I mean, this is a no brainer. You have to do this.
Mm-hmm. Mm-hmm.
And I think he was a little hesitant or not doubtful, but of my ability to be an entrepreneur just because I'm so scientific minded and we don't get any business training and he does all of our taxes. And
Uh-huh.
so that was kind of his role. But I think he was pleasantly surprised by my ability to pick up the entrepreneur role.
Okay, good.
Um,
Yeah. So speaking of entrepreneur and business, what do you think about the business part? Hate it, love it, indifferent?
I don't mind it. I actually think it's kind of a new challenge. That's kind of how I've approached it.
Mm-hmm.
And once I've kind of gotten everything down, it's not really been that hard. I mean, everything bill wise is automated and pays itself. And then I just have to do my thing on the back end with patient stuff as far as billing and that sort of thing. But I mean, technology makes things very easy.
Yes. Make it work for you. So
Hmm.
you and I told you earlier that I forget to add things in. So you're the owner and founder of Coral DPC. How did you come up with your
Yeah.
name?
So I wanted something that kind of went with the beach theme, being local, and I wanted it to be a part of the community. There's a lot of, in this area, we're the Grand Strand, so there's a lot of Grand Strand this or that. There's Palmetto this or that, and there's a lot of the same kind of things, the
Mm-hmm.
themes was with the beach. But No, not a lot of choral things.
Mm-hmm.
And so as you do, you start looking at Chat GPT and asking questions and find me, what's my business name or any ideas for my business name. And so plugging all that kind of stuff in, choral came up. And I thought, well, choral, okay. And started looking into choral and how resilient it is of a structure, and it can thrive in harsh environments in the ocean. And so that kind of resonated with me as a physician in the employed fee for service world. You have to thrive in environments that are harsh,
Mm-hmm.
and
Mm-hmm.
you have to do your job and show up for patients regardless of where you're at and what's going on. So that's kind of how I went with choral
Mm-hmm.
direct primary care.
Mm-hmm.
And I really wanted direct primary care in the name,
Yes.
because I know this movement is just growing and taking off, and I wanted people to be able to know that I am a DPC office.
Mm-hmm.
And because there's a lot of concierge clinics in this area, so people kind of know the concierge model and
Mm-hmm.
concept,
Mm-hmm.
but there are not many DPCs.
Mm-hmm.
And so I really wanted to be able to differentiate myself
Yeah.
with the DPC name.
Yeah. So, did you find it was hard to educate people about DPC in the area because there are so many concierge practices? Like, how did you go about spreading the word about DPC?
Honestly, it helped, I think, because they already had the concept in their mind of paying out of pocket for their healthcare. The only thing I really had to do if they said, "Oh, you're concierge," I said, "Well, not really." And so you just have to kind of differentiate. Then we don't accept any insurance. There's no copays. It's just a flat monthly fee. And so they're like, "Oh, okay." So it actually kind of helped a little bit because I was able to kind of run with it and
Mm-hmm.
just really differentiate between the two.
Mm-hmm.
But it has been a little bit of a challenge to educate people in this area in general if they aren't familiar with concierge or DPC, just because it's an older population, it's a retiree area,
Mm-hmm.
so a lot of over 65, and a lot of over 65 patients really want to use their Medicare.
Yeah. Mm-hmm.
So that's been a challenge, but I really tried to play to the pain points
Mm-hmm.
that people experience because this area is growing so much and so fast. The access is really an issue here. So patients are waiting months to get in to specialists and PCPs. And so they can't get in to see somebody if they're sick. And so that's something that I really try to play off of when I'm talking to people about DPC, um, and try to get them on board
Mm-hmm. Yeah.
with the idea.
Yeah. So you started, let's see, oh gosh, it's been like 6, 7 months now, and you've
Yeah.
enrolled how many patients?
So right now I'm at 107.
Oh, that's wonderful. That is
Yeah.
fantastic. Yeah.
Yeah.
What do you think was the most successful, kind of marketing or draw, for your patients?
Mm-hmm. Yeah. Well, honestly, it's been a lot of different things. I had been in the area, so I worked about 30 minutes away
Mm-hmm.
at the hospital system that I mentioned earlier. And so many of those patients, a good handful of those patients followed me.
Mm-hmm.
So then it just kind of spread word of mouth. That's probably been the biggest thing, is my patients spreading the word for me, which has
Mm-hmm.
been great.
Mm-hmm.
I do try to do a lot of social media if I can. Try to post at least once a week. It's just social media is hard.
It is. It is. Mm-hmm.
And yeah, so, but it's been that. And then when I first opened, I did a lot of boots to the ground, just handing out marketing material, just trying to get the word out that I had opened and I was there. And honestly, that did pretty good. But now I think just the idea of DPC in general is getting out into the world.
Mm-hmm.
And so I've had probably this past week, just with everything going on with health insurance and the shutdown and all that,
Mm-hmm.
I've probably had more inquiries on my website in the last week than I've
Mm-hmm.
had in the last 3
Mm-hmm.
months. And I think people are just seeking it out now,
Yeah.
and the
Yeah.
word's out. And so they're looking for me because
Mm-hmm.
I'm DPC.
That's awesome.
Yeah.
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 I think there's probably 2 or 3, oh, I don't know, maybe more of docs that are on TikTok, and their videos have just blown up.
It blown up.
Yeah.
I love to see it. I'm like, I can't do that. You guys go viral for me.
Yeah, I'll just
Then
repost.
my local people come to me.
Yep, you can do it for me, right?
Yeah.
Yeah. So, what has been your favorite part about DPC? Like something that that you thought maybe you never knew that you could do, or it's just an unexpected joy about DPC?
Oh, I think it's just the freedom and just like the ability to come and go as I please and make my own schedule and spend an hour and a half with a patient if I have to. And I just thrive in that relationship and just getting to know people and talking to people and getting to know my patients on a deeper level. So I think that has been, and I knew that was going to happen. So
Mm-hmm.
that wasn't really a surprise, but I just think that is just, that's what I was seeking and I got it. And I'm so excited that I get to do that now.
It is wonderful. It's great. It's so nice to have the
Yeah.
freedom and the time to do different things and things that maybe you used to do when you were younger, and have time to go back to those things that make you
Yeah.
you.
Hmm.
Because you are in a more kind of a retiree area,
Yeah.
do you have more Medicare patients, or do you have a spread? I mean, who do you like to see in your practice, I guess?
Well, right now it's probably a spread. I
Mm-hmm.
have uninsured, I have Medicare, I have just private insurance, young, what's the word?
Yeah, family.
Business folks,
Okay. Yeah, entrepreneurs. Yeah.
young professionals,
Young
that's what I was looking for.
professionals. Yes. Yeah.
But the people that I think really love it are the ones, so like probably my sweet spot is that age 40, 45
Mm-hmm.
to 64.
Mm-hmm.
And there's a lot of people that are retiring early,
Mm-hmm.
so before they hit 65, in this area especially, and they're trying to bridge to get to their Medicare, and so they've lost their employer coverage
Right.
and they need that, there's that gap for
Mm-hmm.
several years before they're going to be eligible for Medicare. So that's a part of my panel right now.
Mm-hmm. Mm-hmm.
And those people I enjoy because they're out of their, like, they're post employment, so they have all this time to focus on what they want to do, and they a lot of times have neglected their health
Mm-hmm.
maybe while they were working, and now they're ready to take time for themselves, and so they're more motivated to be healthy and to do the right thing and take my recommendations
Mm-hmm.
and
Mm-hmm.
run with it. And so those are the people that I like to see.
What kinds of things do you feel make your practice different from other practices around? I mean, I know there's a couple DPCs in the area, but not many.
There's not yet.
Yeah.
There's I'm the only one in the northern end of the beach.
Uh,
There's one about 30 minutes in south in Myrtle Beach.
mm-hmm.
And I think there's a couple down in further
Okay.
down
Yeah.
south in that area.
Yeah.
But yeah, in this particular area, I'm one of the only. But obviously I think it's just access. That's the name of the game here. And so I'm here and I'm open and willing to see people every day, same day, next
Mm-hmm.
day.
Mm-hmm.
And people really love that.
Mm-hmm.
I have not had the chance to dive into a lot of procedures yet, just because the panel size is small and hasn't called for it.
Mm-hmm. Mm-hmm.
But I try to make known that's something that I also offer and that's covered under the membership, and there's nothing extra with that. And so yeah, people really love that.
Do you have a lab? Do you do labs also, or
I
medicines?
do, yeah. Yep. So I partner with LabCorp and do all my draws in house. The closest draw site is about 20 minutes away.
Mm-hmm.
So it is a convenient thing for patients to have it drawn in the in house.
Mm-hmm.
And that's something I had to relearn. Obviously, it's something I hadn't done since medical school.
Mm-hmm.
So that's been a challenge, and I still am still trying to get my skills up. If you're a hard stick, sometimes we go to just send you to the draw
Yeah.
site. And patients understand
Yeah.
that, and they're all great about it. But yeah, so it has been nice to be able to offer that.
Are you open for office hours every day, or how's your schedule? What's your schedule like?
I try to. I mean, technically, office hours are 8 to 4,
Mm-hmm.
Monday through Thursday, and then 8 to noon on Friday. But if I don't have anybody scheduled, I may not be here. But I check my messages from home and
Mm-hmm.
check my phone from home, and patients know they have access to me.
Mm-hmm.
So if I have to go in, I go in.
Mm-hmm.
But I'm not chained to the desk 8 to 4, which
Yes.
is
Yeah,
nice.
it's so nice. It's so nice. Do you have
Yeah.
help in the office? Did you hire anyone, or are you by yourself?
Nope, just me.
Solo. Yeah.
Yeah. I'm gonna
Yeah.
try to do that as long as possible.
Uh-huh. And so your office, what are you renting? Are you like
Yeah.
subleasing?
I'm
What is your
Yep. No, I'm renting a space
Mhm.
and it's in like a little plaza
Mhm.
with other businesses, but it's kind of tucked away, so there's some privacy. It's nice. It's not a very large space, but I don't really need it.
Mhm.
I have an exam room, a little small little sitting area at the entrance
Mhm.
that nobody ever sits in, right?
Right? Yeah. Yeah.
And yeah, the lab area and a little kitchenette in the back and my office. That's all we need.
Uh-huh. And is it close by to your home or you have to
Yep.
Yeah. Oh.
Yep. About 5 to 10
Oh,
minutes.
that's so nice.
Love it. Yeah. As opposed to 30 minutes when I was in
Oh.
my old job. Yeah. It's
Yeah.
so much nicer to be able to just zip over and back at
Right.
lunchtime if I need to.
What do your kids think about the office?
Love it. I have toys here that I actually stole from them that disappeared
Yep, yep. Mhm.
from the playroom. Yeah, so they come in and they like to pretend to be doctor and get all the toys out, make a mess.
Yeah.
And
Uh-huh. Yeah.
yeah, but they do. They love it. They love to come here and run around.
Mhm. Mhm. And you see kids too, yeah?
I do.
Yep.
Yep.
Newborns?
Hmm.
You don't you?
Yeah.
Yeah, all right.
My 100th patient was a 4-day old newborn.
Oh, that's wonderful.
I know.
Yeah.
I know. They're so great.
I think I did see your picture that you did post a picture of that one, and that was
Yeah, that was
precious.
so cool.
That was great. You're at 100 something now. What do you feel like? Is it comfortable? Are you feeling like I definitely can see more people, or is this where do you want to end up, you think, number wise?
I definitely want to see more.
Mhm.
I think I want to hit 300, 350, I think is going to be my cap. Obviously, that might change.
Mhm.
Might decide I don't want to see more than that or
Mhm.
less.
Mhm.
So it's going to take it 100 at a time
Mhm.
and reassess.
Yeah.
Yeah.
Yeah, because right now, I mean, it sounds like you're coming along at a pretty good clip. I mean, that's really amazing. 100 and something after
Yeah.
6 months. It's great. That's wonderful.
Yeah.
So, what do you
So
see? What do you see in the future for your practice? Are you going to want to kind of hone in on a special kind of population or a special kind of passion of yours? Or you think you want to keep continuing with what you're doing? That's great.
for now, I just really want to focus on the primary care aspect
Mm-hmm.
and just building the practice, getting it a good, solid foundation with a good patient base, and then maybe think about other things because I'm in this retiree area. There's a lot of aesthetics and a lot of rejuvenation clinics
Mm-hmm.
and HRT
Mm-hmm.
and integrative medicine.
Yeah.
And those seem to be popping up kind of on every corner. So I don't necessarily want to go that route,
Yeah.
but just do what I do best and
Mm-hmm.
really focus on family medicine,
Right.
primary care,
Yeah.
and be the best PCP I can be.
Yeah. Yeah. Not saying that you have to. Just some
Yeah.
people they have ideas about doing different things, and
Yeah.
but that's
I do want to be more. I'm thinking about going into the and getting the menopause certification,
mm-hmm.
just because so many of my older women come to me, and I want to give them the best answers possible. So
Mm-hmm.
that's probably the next step in training or certification that I'll go for.
Mm-hmm.
But as far as anything else, like the aesthetics and the
Mm-hmm.
and
Mm-hmm.
stuff like that, I don't see myself doing that.
Definitely. But the good thing is, if you do decide that you wanted to add something else, you have the time to
Yeah,
do it, right? And you have the
yeah,
time to research and kind of learn. And that's why I
yeah,
asked, because you are DPC and you have a little that entrepreneur kind of mind, you're always thinking about what's the next thing. And so sometimes that's what it is. And sometimes, just like you said, just focusing on the bread and butter primary care, which is
yeah.
it's wonderful in itself. Well, what would you say to somebody who is thinking about DPC? Like, do you have any advice for people who are considering it?
I just do it. Just do it. It's worth it. It's so worth it. I don't know where I would have been if I hadn't learned about DBC. And my personality is such that once I learn some about something and once I commit, and put my mind to it, it's going to happen. It's just,
Mm-hmm.
and so I think some people are hesitant and are scared of the business aspect or the whatever it is that's holding them back. And so I just say, just go for it. Just, it's, you can do it. If you, we learn all this stuff in medical school, all these intricate pathologies and treatments and medications, and business is easy. It, you just, once you dive in and you start doing it, it doesn't take much to learn. So
Mm-hmm.
we can do it. We can do new things.
Mm-hmm.
So
Yeah,
yeah, that's what I would say. Just go for it.
absolutely. Yes, you're right. I mean, yeah, you've learned all these other things. You learned the Krebs cycle. I mean, my gosh, right?
I blocked it out maybe of my mind.
You knew it at one point. Yeah. What would you say is has been your biggest struggle opening up the DPC? What's given you like made you lose sleep?
I don't know if other, I feel like this might be across the board when you go from a busy fee for service practice to DPC,
Mm-hmm.
but I don't think a lot of people talk about it is the guilt.
Mm-hmm.
I feel many times that I need to be doing something.
Mm-hmm.
Like when you're in fee for service and you're seeing 20 people a day, there's always something to do. Like there's
Mm-hmm.
20 things to do at any given point at the day. And so you get in this, it's like a conditioned behavior where you just feel like you have to be doing something all the time. And so that's been a little bit of an internal struggle
Mm-hmm. Mm-hmm.
that I don't have to do that. And I have to remind myself that you don't have to be doing something every single second. Like
Mm-hmm.
you don't, you can go home early
Mm-hmm.
and not feel guilty about it. So that has been kind of a challenge to try to get over my, in my own brain, is that now yeah, you have the time. There's nothing wrong with that.
Right. I think you're right that we're so it is ingrained in us from the very beginning of residency even. You're always doing something and
Yeah.
you get used to it.
So like going home on a Tuesday at 2 o'clock in the afternoon, I'm like, oh, should I be doing this? Like, do I
Mm-hmm.
like, I just feel really uncomfortable. But then I'm like, wait a minute. Yes, you can do that.
Mm-hmm. You can. You're the boss.
That's right.
You're the boss. Yeah, we just hired a nurse practitioner, and she was telling me yesterday, she said, I go home and I don't know what to do.
Right.
Because she said, I used to chart. That's what I did. And now
Mm-hmm.
everything's done, and I don't know what to do with myself.
Yeah.
I was like, well,
It's, you have to unlearn that response. I just, yeah. And so I don't know how long that takes to unlearn that after
mm-hmm,
all these years, but
mm-hmm,
I'm still struggling with it and it's months in.
mm-hmm,
So
mm-hmm. Well,
surely it'll happen at some point.
I think it's a good thing though, a good problem to have.
Yeah.
You can get used to it. But yeah, I was like,
Yeah.
yeah,
Yeah.
maybe you need to learn a new hobby. I don't know.
Maybe you're right.
Yeah, I think a lot of, I don't know, maybe not just DPC, but I think business people, they have a lot of creativity, and that's why they like business because you can create whatever you
Yeah.
want.
Right.
It's easy to change. Whereas when you work in
Mm-hmm.
a big business or a big system, you can't, you just really can't
Yeah.
change things
Right.
ever. Or if it does, it changes very, very slowly. Yeah.
Yeah.
Yeah. So I think the business part, you have a lot of creativity and you can really create different things. You can create different ways of doing things and just pivot. If it's not
Yeah.
working for you, well, try it a different way.
I know. Yeah. I totally agree. And again, that's a learned response too. So that's still taking some getting used to, and not being so rigid in how I do things.
Mm-hmm.
So
Mm-hmm.
again, just years and years of conditioning, trying to reverse
Yep.
that conditioned behavior.
Yeah.
Uh-huh.
Mm-hmm. Would you have done anything differently about the way you started?
If I could have, I would have started sooner. I mean, to when I went to masterminds, I told, like I said, I drank the Kool-Aid. I was all in. Like that weekend, I was ready to quit my job the next day. And I just couldn't.
Mm-hmm.
Obviously, there were things that some things that needed to fall into place first
Mm-hmm.
before I could open the DPC, which is why I had to wait.
Mm-hmm.
So that would be the only thing, is I would have done it sooner if I could have.
Mm-hmm.
Yeah.
Yeah. I think that's one thing that a lot of people, when I ask them that, that's generally the sentiment is, I wish I'd done it sooner.
I mean, and my main barrier was my student loans. So I was
Mm-hmm.
in the PSLF program and I had like 1 year to go. I was at the finish line. So I said, that's when I said, okay, I just got to make it through this year
Mm-hmm.
and get those loans forgiven, and we're set. We can go forward, full court press.
Yeah.
And so that's what I did. I mean, I got my loans forgiven in October of last year,
Mm-hmm.
and in November I put in my notice. Yeah.
Yep.
So
Yeah. So how long of a notice did you have to work?
90 days.
Did you take?
So I put it in November and opened in March.
Okay.
Hmm.
Yeah. So you
Yeah.
really.
So I had a little bit of time,
Mm-hmm.
but
Mm-hmm.
not much.
Mm-hmm.
My space had to be completely built out,
Oh wow.
which,
Mm-hmm.
yeah, which was done by my dad and my husband. So I
Ooh,
got
wow. Way to
yes.
save.
Yes, so lucky that I have construction men in the family. So that would have been, the cost on that would have been exorbitant in this area if I had to hire someone. But that was great. They built the whole space out just the way that I wanted
Mm.
it. And
Oh, wow.
so, and it only took them about 8 weeks. So there was a
Gosh.
period, there was about a month where I was kind of in limbo in between opening and my fee for service.
So was it a shell? Your office?
It was just a big rectangle, and another medical facility was actually using it as storage. So there was like wall to wall, floor to ceiling, just junk.
Oh
It
no.
was like medical records, office equipment,
Wow.
old furniture. And when I looked at the space, you couldn't even walk through it
Oh my
because there was
gosh.
so much stuff. So they cleaned it all out, and by the time it was done, there was carpet now. It was awful. So we ripped up the carpet. So it was cement floors, just a big rectangular space. And so they put up all the walls, cabinetry, all the flooring. Yeah, they did everything.
Wow.
It was
Plumbing
great.
too? They had to do plumbing?
So the
Sorry.
plumbing was there. There was
Oh,
a bathroom.
okay, good.
Yes, so the bathroom, and we really tried to kind of build the space around the plumbing so they didn't have to
Yeah,
move anything.
that's smart.
We were able to kind of configure it so that we didn't have to do a lot of plumbing. But
Mm-hmm.
yeah, they did. They put in the sinks. They did everything else.
Mm-hmm. That's so cool that you got to build it out
Yeah,
yourself. So was
yeah.
there anything in your build that you're like, I really want this, and asked for
I
special help?
really wanted. I really wanted a comfortable. Like I wanted my office to be the biggest
Mm-hmm.
area and to be the most comfortable with the most lighting. So
Mm-hmm.
I made sure that my office was, because there's only a couple of windows. So my office has the windows,
Mm-hmm.
and I wanted to be able to have that comfortable open space. And so I have a couch, I have a couple of chairs. And so that's kind of where we sit and talk most of the time when I'm with patients. And
Mm-hmm.
it's comfortable. I wanted that relaxed kind of sitting with a friend and
Mm-hmm.
that kind of a feeling.
Yeah,
So I really wanted my office to be that. It's
that's
great.
awesome. So is that your
Yeah,
favorite part of your office? The office build?
probably.
Yeah. And then do you have a separate like little lab area?
Yeah.
Uh-huh.
Yep. So I have a little, and it's able to, I can close the door, lock it off. And so there's a counter space and some cabinets above and below. And yep. So that's all able to be separated from the exam room,
Mm-hmm.
which is in a different space.
Mm-hmm.
So
That's awesome. Did you make the little
yeah,
pass through like for the urine count?
it's a good idea. I should have done that. Dang.
Well, they could cut a hole for you.
I call my husband, hey, I need you to cut a hole in the wall. Anne gave me a really good idea.
I just always think about that when I'm like, oh yeah, when I build a place, if I build a place, I'm gonna have a little little pass through for the.
Little door. Yeah.
Yep. Okay, so for your next office,
Yeah.
remember,
Mhm.
put that down. All right. Well, anything else that you want to tell us about your practice, or to tell listeners about DPC?
I just think so highly of all of the DPC physicians that have trailblazed the way for us,
Mm-hmm.
and just that's who I look up to, is you
Oh.
and all these guys that have been doing this for years
Mm-hmm.
and that paved the way for us and for this movement to just kind of blow up, which I think it's going to. I think this is the time,
Mm-hmm.
and
Mm-hmm.
I see it already,
Yeah.
and I'm excited to be part of it now.
Yeah.
So
Yeah, definitely. I'm excited that you are. You can spread the DPC
yeah.
word. Yeah. So,
Yes, yes.
mm-hmm.
Keep going viral,
Right.
colleagues. Help us out.
Yeah, definitely. All right. Well, thank you so much. And tell us how people can
Yeah.
find you.
Yes. So my website is coraldpc.com.
Mm-hmm.
And I'm also on Facebook and Instagram. And you can probably just find it by Googling Coral DPC in Little River, South Carolina.
Yep. All right. Well, thank you so much. I appreciate you coming on. And hopefully, I'll
Yeah.
get to see you again, maybe at the summit.
Yes, definitely.
Or,
Thank you so much for having me. I
yes.
love talking with you and talking with other DPC docs. So it's been fun. Thank
Yeah,
you.
it's really nice to see you and see you're succeeding, especially I call when I see people that I've met at the masterminds or at the summit, and especially the masterminds, I call them my baby docs.
We kind of are.
My
Yeah.
baby DPC docs, and so now you're like a
Yes.
toddler.
You have to hold our hands and help us through this
You can
process.
walk now. Walk on your own.
Uh-huh.
All right, thank you.
Okay. Thank you so much.
Thank you for listening to DPC Life.
Before we finish, if you're a woman in direct primary care and you've mostly been figuring this out on your own, you're exactly who this gathering is meant for. The details are in the show notes. And if you can't make it in person, I've also put together a physician community and some tools so you don't have to do this by yourself.